Hello, everybody. Welcome. We are gonna give it a couple more minutes before we dive in. But if you're here with us already, go ahead and let us know where you're tuning in from in the chat. I hope everyone is safe and warm. No, that's asking a lot. Awesome. Seeing so many familiar names. We love it. We also love the new names too. We love all the names. Okay. Well, I think we'll probably still have some people continue to join us since it's right at noon my time, but why don't we go ahead and dive in just in the interest of staying on track. You can continue to say hello in the chat and let us know where you're tuning in from, but we'll get moving. So thank you for joining us this morning or afternoon or wherever we are. I'm Heather. I'm the Midwest Save Our Streams coordinator with the Isaac Walton League, and I'll be sort of hosting today. We're also joined by Dave Cwiertny with the Center for Health Effects of Environmental Contamination at the University of Iowa. And this is the first Clean Water webinar of 2024, so really happy to have you all joining us. Some housekeeping items. If you've joined one of our webinars before, you know that we use the chat as well as the Q&A box. It's that kind of like speech bubble looking thing at the bottom of your Zoom window. And that's a great place to drop questions throughout the presentation so that at the end, we can just kind of go through them all and hopefully answer as many as possible. And we will be attempting to answer questions at the end, hopefully like time permitting, we can answer everything. And also we are recording right now. So if there's anything that you miss or if you need to hop off early and want to catch anything at the end, we will be sending around a recording of this webinar probably tomorrow. If not tomorrow, then by Thursday at the latest. So with that out of the way, I'm just going to begin. Before I turn over the mic to Dr. Cwiertny, we are going to make a little bit of a connection between this webinar and Nitrate Watch. I'm sure many of you are familiar with this program. After all, you are joining us today. So if anyone on this call has participated in Nitrate Watch, I thank you heartily. For those who aren't as familiar, this is the latest and greatest community science project of the Isaac Walton League, where we are engaging volunteers all across the country to participate in nitrate monitoring, whether that be of your drinking water or from surface waters like rivers, lakes, and streams that you care about. And this program launched in February of last year. So we're coming up on our 1-year anniversary, which is very exciting. We've had so much participation. I'll share a little bit about that later, but we are going to be putting out an annual report very shortly. So if you're interested in sort of diving into the stats and the nitty-gritty of what we've done in the past year, you should keep an eye out for that report on our website and in our newsletter. So we, of course, care about nitrate pollution for many reasons, and I will not belabor this very long since I know Dr. Cwiertny is going to do a much better job explaining it in just a moment. But the high rates of application of nitrate and other nutrients to our environment lead to lots of issues. Of course, the human health side of things, which we're here to talk about today. The environmental issues are very sort of well known and well observed, things like algae blooms and fish kills and the dead zones all across the country and also in the Gulf of Mexico. And then, of course, the economic impact of all of the above. There was a paper in 2015 that sort of analyzed and summarized the economic impact of nitrate pollution on things like, health issues, water treatment, the environmental impact, property value decline, and many other things. And they found that in the US annually, we spend over $210 billion as a result of this pollution problem. So for whatever reason resonates with you, this is obviously a very important problem and hence Nitrate Watch. So where does our program come in? well, our goals are to first raise awareness, to connect people to this problem and explain sort of how it impacts their lived environment and their health, to identify hotspots all across the country where nitrate pollution is an issue, and then to ultimately advocate for solutions that will address the problem from the beginning. So first and foremost, we're raising awareness by getting kits in the hands of volunteers. And this is a picture of the kits that are sent in the mail. So if you already have one, this will look familiar. We include 25 test strips. So this means that you can test one spot 25 times. You can test 5 spots 5 times. You get the idea. All data is useful and great. And this is just a great way to get information into the hands of people who might not already be aware of the nitrate situation in their area. In addition to providing the test kits, we have lots of educational resources out there. This slide gives you kind of a snapshot of those resources, webinars being one of them. Hello, thank you for joining. But all these resources and more can be found on our website, nitratewatch.org. The newsletter is one, if you're not already on it, I definitely recommend that you sign up. Those are monthly, and they're just kind of a great reminder about participating, about opportunities for advocacy, about learning resources, and a lot more. That second goal was identifying hotspots, and we, of course, rely on our volunteers for this one. Our data is reported to the Clean Water Hub database, which is a really powerful data visualization tool if you haven't already checked it out. But we encourage our volunteers to, of course, report their data so that it can be visualized and used by themselves and others to sort of get an idea of the scope of the issue, and also dive in on sort of that nitty-gritty, which regions are hurting the most. And so we create these really useful images like our color-coded graphs and our auto-generated maps, maps and graphs of data that can be used to understand the problem and also to communicate about the problem. So if you're measuring data and you're seeing high readings and you want to get the word out, these can be really great visual tools to use. So these are those stats that I said I would share. This is participation in Nitrate Watch as of last year. So basically our first year of existence, we sent out over 800 kits. There were folks from 33 different states reporting data, which is over half. So I am impressed. We had almost 1,400 data points, and this is just Nitrate Watch. This isn't including the folks who do Save Our Streams Chemical and report nitrate as one of their parameters. So this is fantastic. And there were 650 unique sites created and reported at for Nitrate Watchers. So if these stats excite you, like they excite me, then you definitely want to check out our annual report when it is completed by the end of this month, because there will be more. And then, of course, our advocacy steps. So this is a really important piece of this project that we intend to sort of build and mature as the program grows. So currently on our website, there is a What You Can Do page, which houses our advocacy resources and some other education avenues. So there you'll find things like our petition, some templates for letters to the editor or letters to representatives, sort of amplifying this issue in those different avenues. And then we have been participating in Farm Bill advocacy, trying to connect our nitrate watchers with sort of advocacy steps to get your elected officials to build a farm bill that supports soil health and water quality. And of course, the schedule for this kind of all blew up at the end of last year, and we'll continue to remain engaged. But these advocacy steps are definitely, step one in our journey towards addressing the issue of nitrate pollution, both nationally and regionally. So that was my whole spiel, and I think I should have a slide, but it might not be showing up. If you're interested in getting in touch with me, if you have questions, a good email for me is nitratewatch@iwla.org. And then, of course, our website, I've mentioned it already, but it's www.nitratewatch.org. You can request kits, you can find all of our educational stuff and advocacy stuff, and more. So with that, I'm going to stop sharing my screen and I'll pass the mic to Dave Cwiertny.
All right, thank you. I guess I'll get my screen shared and we can get going. I'll put in I think that's a great program. I'm really excited about the Isaac Walton League doing that. Studies have shown that citizen science is one of the best ways to get new people aware of a problem and keep them engaged in a problem. And if you ask me about what we need around this problem of nitrate pollution, particularly as we think more about its impacts on public health, we need to bring more people to the table to care about the issue, to advocate and demand change on these issues. And so really thrilled to see the turnout on this. Thanks for having me. Hopefully you all learned something new from this. Feel free to put all sorts of questions in the chat. I'll do my best to stick around as long as possible to answer. A little bit about who we are. I am the director at the University of Iowa. In addition to being a professor in civil and environmental engineering and chemistry, I direct the Center for Health Effects of Environmental Contamination. I don't expect many of you from outside of Iowa to know what this is. I don't even expect some of you in Iowa to know what this is. But we were a center that was founded in 1987 through the Iowa Groundwater Protection Act. And our mission was pretty clear. It was to support and conduct environmental health research that really looks at the links between environmental quality and public health in Iowa. And so that's really what we try to do. We run a lab. We're trying to increase testing. We run research. We do what we can to really help close gaps so people understand, how the environment might be causing harm, if it is. I asked Heather as I did this, I said, well, some of my talk is going to be Iowa focused simply because it's who I am and it's how I come at this problem. But for those of you that aren't in Iowa, for those of you that are, I'll start out kind of couching my interest in this issue through Iowa water quality. And the big one is that I really think we have some of the worst water quality in the nation. I don't even think we fully appreciate how bad it is. Hold on one second. I want to turn on my laser pointer if I can figure out where to do that. Here we go. So what I'm showing you on the left, it's an older map from 2016, but it wouldn't change all that much if I were showing you something more up to date. These are all of our water bodies that are impaired under the Clean Water Act. The Clean Water Act being the federal statute that regulates surface water quality in the United States. Everything that you're seeing in red and orange is something that is impaired and would require action to improve or restore the quality of the water there. Probably more informative is this table on the right. And you think of these different categories in the Clean Water Act, and category 4 and 5 are our impaired waters. That's what you're seeing on the map. You actually see here that of I think about almost 3,000, maybe a little under, a little over 2,000 water bodies that were actually analyzed in this particular year, which I think is about half of the water bodies in all of Iowa. We only have 15 that are fully compliant under the law. And I think perhaps even more troublesome, I often say we don't fully know the extent of how bad our water quality is we acknowledge that we have 1,500 water bodies that we have insufficient data to even know if any designated uses are met. And so we have pretty significant water quality challenges. And I'll add that this doesn't even really, we don't have numeric criteria for nitrogen unless the water body is used as a drinking water source. So if we added numeric criteria like some of our neighboring states do, we'd probably have more impaired bodies. Where do our challenges come from? I'm going to be pretty upfront about it. We know our water quality challenges come from our agricultural intensity. This is a map of our known CAFOs here in Iowa, particularly up in the northwest portion of the state. You see a high density. What you're seeing in the different colors is open feedlots, combined feedlots, and then confinements. And then you have the size of the symbol is telling you the size of the feedlot. So that's a tremendous amount of production that we have in the state, particularly from animal agriculture. And those animals produce waste. And so I think to help sort of understand where our nitrogen comes from in Iowa, I'm going to put in a shameless plug for my good friend and colleague, Chris Jones. For those of you that have not bought his book, you should. It's called The Swine Republic. Chris is probably known most for this map that he made with some colleagues that was looking at all of the animal waste that gets generated in Iowa and converting it into the equivalent human population, knowing that a hog produces the waste of 4 humans. And then what you're looking at here are mid-scale watersheds. They're called Huck 8 watersheds. And you're looking at the human equivalent population of fecal waste that's generated in each of those watersheds. And so when we know that nitrogen, one of the big components of a manure is nitrogen. It's why it gets land applied as a nutrient. We have like the population of Mexico City equivalent here in this northwest watershed, Tokyo here. If you think about where Des Moines is located and the amount of waste that's being applied up watershed, it's no surprise we end up with nutrients and nitrate at elevated levels in our waterways. I want to make it a point, I won't talk about it here, but we shouldn't ignore that there's other things in that waste that gets land applied, right? There's pathogen, there's antibiotics, there's other things that we need to be worrying about. One of the things we do at CHEEC is while we definitely focus on nitrate, we try to expand the conversation. Like, nitrate is just one bit of our water quality challenges in Iowa. I want to be, leave no mistake about it. People will say, well, there's different sources of nitrate that could be, causing our problems here in Iowa. How do we know where it's coming from? There's been research that included Chris and his colleagues at the University of Iowa, along with researchers from the Iowa DNR, that basically says manure driving our stream nitrate. The analysis shows much higher stream nitrate in the two watersheds where livestock concentrations were greatest. And that just speaks to, we know what we need to do. Chris and I talk a lot about how this gets billed as this complex issue that we need to study more. We need to reduce our N inputs. and that would go a long way towards getting our nitrate and nitrogen export down here in Iowa. When I moved to Iowa, I came from California in 2011. Everybody talked about nitrogen in the context of the dead zone primarily, that was the big problem we were trying to solve. And we have a reporter, Todd Dorman, who coined this phrase, the dead zone starts here. If you're not familiar with the dead zone, it's down in the Gulf of Mexico. It's this area of low dissolved oxygen concentrations. Nutrients from the Mississippi River discharge into the Gulf. Those nutrients get consumed by biomass. And so things like algae will bloom up. They will die because there's not enough other nutrients to sustain them. As they die, they sink to the bottom. As they decay, they consume oxygen, leading to this massive swath of the Gulf that is free of oxygen. And research by Chris and his colleagues have shown that here in Iowa, while we're a small percentage of the land area and a small percentage of the water area that drains into the greater Mississippi watershed, contributing 30% of the nitrate. And you see that with the upper Mississippi and the Missouri watersheds as well, basically saying that we are a disproportionate source of that nitrogen. But one of the things we also try to do is get people to understand that nitrate is a problem closer to home because of the health implications. We regulate nitrate in drinking water. And this was probably most visible back in 2015 when it came to a head where the Des Moines Waterworks, which is situated here, think again about all that livestock I showed you that was up here, took to court. They sued 3 drainage districts north of them over the discharge that was coming from tile lines that contained elevated nitrate levels. And then that nitrate was flowing into the Des Moines Waterworks' source zone that they use to treat and give to the consumers in Des Moines. They were suing, saying our water's coming in polluted and something should be done to stop it. That case was eventually thrown out. Essentially, what the Waterworks was trying to argue is that tile drains, which are essentially exempted in the Clean Water Act, should be considered like point sources, which the Clean Water Act covers. But because they're exempted, there was really no standing for them to be able to make that claim, and so this did not go anywhere. But it raised the issue of, it's not just the Gulf of Mexico problem. Our problems in nitrate aren't just thousands of miles away, right? They're here close to home. And that's the public health discussion that we're here to have today. We regulate nitrate in drinking water at 10 milligrams per liter as nitrogen, and that as nitrogen matters. It's just thinking about the available nitrogen portion of nitrate, not the oxygens that are there. And we regulate it at 10 milligrams per liter as N for what's known as methemoglobinemia, or is commonly referred to as blue baby syndrome. That nitrate gets transformed into the body to another form called nitrite, and that nitrite is able to interfere with how oxygen interacts with hemoglobin. And if you remember from grade school or high school biology, that hemoglobin is what's helping transport oxygen through blood to the different portions of our body so we get the oxygen where we need it. If you've got this interference coming from nitrite, you're basically essentially starving the body of oxygen. This is most problematic in infants. And so if you are feeding infants with formula and you're using water that's high in nitrate, you have the potential for the baby to turn blue from the lack of oxygen. In severe cases, it can lead to death. These cases are now rare. This is an instance, regulations work. We should acknowledge that when we regulate, we see change. Regulating at 10 milligrams per liter has really helped drive blue baby to not be a pressing issue. Now, I want to be clear, and we'll come back to it. Private well users, they're not under the Safe Drinking Water Act. So there'll be, there's still challenges where we have to worry about folks on private wells that don't have a centralized water supply treating the water. But this is really the motivation for why we regulate. have a discussion about public health and nitrate, we do need to have some familiarity with how we regulate drinking water. So bear with me as I just walk you through. I don't know if any of you have ever gone to the EPA website and looked at your national primary drinking water regulations, but there's this nice table. This is what it would show you. It lists the contaminant. We'll come back to what the MCL and TT is. It talks about the potential health effects. It talks about the common source of the contamination. And I want to start our conversation over here on what's known as the public health goal. So in the regulatory process, the first thing that has to happen is the EPA needs to set the public health goal, which is essentially a blue sky scenario. If we had all the money, all the resources, all the technology in the world, how much of a chemical or a contaminant would we want in our drinking water? And so take something like allichlor, which is an herbicide that's used in row crop production. So something we worry about in Iowa, it increases risk of cancer. We have a rule that essentially anything that's a cancer-causing agent, we would set our public health goal at 0. I think we can all agree that none of us would want a carcinogen in our water supply in a perfect world if we had all the resources. But if you look at the actual standard that's on the book, it's the MCLs, the maximum contaminant level. It's not 0. It's 0.002 milligrams per liter. And so you might be wondering, well, why isn't the enforceable standard, the MCL, 0? It's because we don't live in that blue sky world, right? There are limits to technology. There are limits to costs. And we have some amount of acceptable risk that we are willing to take in our drinking water to allow a little bit of a problem through so that we can keep water costs affordable. We can, take advantage of available technology. This is something we've always done, this concept of acceptable risk. EPA is supposed to set the regulation as close to the goal as possible, but they have to account for things like technology and economics. So I got a little ahead of myself. So the other part that's not really talked about there is the two different types of risks we worry about. The first is what's known as acute risk. And so when I use the word acute risk, what I'm talking to you about is there's an immediate health impact after usually a short duration of exposure. And so nitrate is one of the few contaminants in drinking water that we do regulate as an acute risk, that if a baby is drinking formula that's made with high nitrate water, that blue baby syndrome, that impairment of oxygen transport happens almost immediately. It is an acute health risk. There's only a handful of things we regulate for acute risks. Most of what we regulate in drinking water is for the other type of risk, which is chronic risk that develops over long-term exposure. Say, I've been drinking this water for my lifetime. And this is where we start to think about things like cancer as a potential endpoint, that you need long periods of sustained exposure, often at lower levels than what you worry about with acute risk. It should make some sense that acute, shorter duration, higher levels, immediate effects. Chronic tends to be lower levels, longer duration, delayed effects. And so for now, what we regulate nitrate for is that acute risk of blue baby syndrome. We do not regulate nitrate. The regulation does not reflect anything to do with this chronic risk. And I want to talk more about that because that's where we're at in the public health discussion on nitrate. So a quick look at the regulatory history on nitrate and nitrite. They go together in drinking water. It's 10 milligrams per liter as N for nitrate. It's 1 milligrams per liter as nitrite. And I want to give you a little bit of this regulatory history because you're going to have questions through this of why aren't we doing more? How did we get to this point? And I want you to see the process that is getting played out that leads us to where we are. But nitrate was actually one of the first things we worried about in drinking water in 1975 when we set the Safe Drinking Water Act. The EPA had to promulgate national interim regulations. Nitrate was one of the ones. It was set at 10 milligrams per liter as N for nitrate and 1 milligram per liter as N for nitrite. And this interim primary drinking water regulation was finalized in 1990. When a full health assessment was conducted and EPA came back and said, this is where we will set the MCL. So if you go to that table, you can see both nitrite and nitrate there. And if you see the health effects as to which we regulated for, it is entirely the risks to infants. Infants below the age of 6 months who drink water containing nitrate in excess of the MCL could become seriously ill and if untreated may die. We see the sources of where it comes from, including that runoff of fertilizer use, as well as those other ones like leaking septic tanks, sewage, erosion of natural deposits. If you remember what I told you before, though, the thing I want you to take away is look at these public health goals. It's 1 in 10. And our MCLs, the actual enforceable laws, are 1 in 10. So in the eyes of the EPA, when you see the MCL, the actual standard, equal to that blue sky public health goal, it's essentially signaling that we think we can do no better in how we regulate nitrate, that this regulation is the blue sky scenario. And I think the question that a lot of us are wrestling with today is it? Like, should we be doing more? And the reason we should be thinking about doing more is because we know for some time that nitrate and nitrite that we get through foods, right? Things like bacon, things like certain vegetables are high in nitrate and nitrite. And so we've often worried about dietary nitrate. And we know that nitrate and nitrate gets converted to nitrate up here through some enzymes in our mouth, and then it's transported down into our GI tract. And we know there that it starts to react and get transformed into what are referred to as N-nitroso compounds. And N-nitroso compounds we know are cancer-causing agents. And so this is why you sometimes hear about organizations that talk about bacon causing cancer. It's the things like nitrate and nitrite that are in them that then in our body can form things as they're getting broken down and metabolized by us into things that we don't want. We are pretty comfortable with the science around dietary intake of nitrate. What we are only becoming more aware of is this idea that maybe we need to be more concerned about the nitrate we get from drinking water, particularly when there's high levels of nitrate in drinking water. Will it go through this same pathway? Could we get this same formation of these N-nitroso compounds? And could there be this potential for nitrate that we're ingesting through drinking water to also increase risks of cancer and these other chronic diseases through this mechanism or other ones that might be relevant in the body? And so, you know, when giving this type of talk, I'm not going to take too deep a dives into the science. I figure you probably don't care too much about some of that. I'm trying to give you the headlines. And so I'm happy if you would, it's great to hear a recording is going to be shared. You'll have my email. If you want copies of any of these papers, like this one's open access, I'm happy to share them with you. But this was a recent review that was done by my predecessor at CHEEC, Pete Wire. He used to run the Center for Health Effects of Environmental Contamination. So that's why I focus on this one. See, there's CHEEC. It had researchers from the National Cancer Institute, folks from other research universities, the United States Geological Survey. This was in 2018 and basically looking at the most recent data and science that's out there on the risks of nitrate in drinking water in human health. And this is probably the part from the abstract that is most relevant to the discussion today. Considering all studies, the strongest evidence for a relationship between drinking water nitrate ingestion and adverse health outcomes, besides blue baby syndrome, is for colorectal cancer, thyroid disease, and neural tube defects, so birth defects, spina bifida. Many studies observed increased risk with ingestion of water nitrate levels that were below regulatory limits. And so most of these studies are epidemiological studies. And so what these studies do is they will look at the health of a population. They will try to account for all the potential exposures that can happen in a population. I will say one challenge with epidemiological studies around nitrate in drinking water is we do get a lot of nitrate and nitrite in our diet that you have to account for. But what these studies, particularly the ones that I'll show you in the next few slides, look at those health descriptors of a population. Is there elevated incidence of something like colorectal cancer? And then do we see statistically significant associations with the levels of nitrate that might be in drinking water? And so it's not a causation thing, right? Correlation is not equal causation, but these are these associations that you find by looking at the health of a community. You account for as many variables as possible. You use the statistical analysis and you look for meaningful associations that say, maybe the incidence of something like colorectal cancer in this population is due to the fact that this community is drinking these elevated levels of nitrate, okay? The challenge here being is that in many instances, studies are showing below that 10 milligram per liter evidence that there could be these increased risks. This is the summary of work that Pete Wire did with these collaborators across the US. One was a very well-known study known as the Iowa Women's Health Study. So working with a subset of Iowa population that are women, that they had enrolled in the study and collected information on. They found a 1.6-fold increased risk of bladder cancer if these women were drinking above 5 milligrams per liter as N for more than 4 years. Ovarian cancer, a 2-fold increase at risk if they were ingesting above 3 milligrams per liter for over 11 years. And thyroid cancer at a 2.6-fold increase above 5 for 5 years. So again, these are these chronic effects. There's an exposure level, all of which are below the current standard, all for these extended durations. But I'm sure for some of you, you see these years and you're like, that's not very long. And I agree with you, right? These are studies that should cause us to want to do more and be more proactive and precautionary if we can about risks associated with nitrate in drinking water. There was another one focusing on reproductive health with the National Birth Defects Prevention Study. This was between Iowa and Texas, twofold increase in spina bifida above 5 milligrams per liter, limb deficiencies, cleft palate, again, all below 10 milligrams per liter. To this day, when I'm asked, and I get asked often, if someone is pregnant and they're asking questions about their water quality, I would always encourage them, if they have the financial means, to one, test their water and figure out their nitrate levels. And if they are in this 5 to 10 range, it might be a worthwhile investment to get a treatment device or shift to a bottled water, an alternative source that you're confident has lower levels of nitrate. In my mind, even though there's more work that needs to be done to demonstrate that there is this link, I don't know that it's worth the risk if you're an expectant mother and concerned about these issues. You might be wondering, okay, well, did the EPA consider these effects in 1990 when they set the standard? And in fact, they did. And so, digging through the actual documents that the EPA put out, and this looks like this was taken much longer than 1990. This is, bear with me on showing text-heavy slides, but I think it's important that you see that the EPA, in their risk assessment, in their health analysis, looked at things like reproductive effects and cancer. You see at the time, only 2 studies are available on possible developmental or reproductive effects of nitrate in humans. So at the time when the standard was set, there just wasn't a lot of evidence suggesting that more needed to be done around reproductive effects. And if you look down below, it's a similar story for cancer. Many epidemiological studies have been performed to determine if ingestion of nitrate or nitrite are associated with increased risks of cancer. But they talk about water, food, other factors that increase risks. These studies are not adequate to show that nitrite caused the increased risk that were observed in some studies, given all of those other factors that you have to account for. This is one of the challenges with regulatory setting. As new information becomes available, how quickly can the EPA adjust to that information to set a more stringent standard? It wasn't that they weren't thinking about these back then, there just wasn't a convincing body of literature to draw upon. Since then, there's been, most of us that talk about this, particularly with the press, we say there's emerging evidence, there's an emerging body of literature. So I thought I would show you some of that emerging body of literature, right? So you understand that it wasn't just work done at CHEEC with Pete Wire and his colleagues before I took over. There have been other studies. This is one out of California that was looking at drinking water of nitrate in drinking water during pregnancy and links to spontaneous preterm birth. And this group out of Stanford, the results suggest that nitrate in drinking water is associated with increased odds of spontaneous preterm birth. And we estimated modestly increased odds associated with tap water between 5 and 10, with tap water below 5, suggesting that there might be an influence of nitrate in drinking water below 10 milligrams per liter in terms of this spontaneous preterm birth. Another one, this one based out of Denmark, nitrate in drinking water and colorectal cancer risk, where they were doing a nationwide population-based cohort study. We found statistically significant increased risks of drinking water levels above, this is the one in parentheses that we care about, 0.87 milligrams per liter as N. This is 3.87 milligrams per liter as nitrate, if you're interested in that, why the numbers are different. Well below the current drinking water standard, which is 11.3 in Denmark. Our results add to the existing evidence suggesting increased colorectal cancer risks of drinking water nitrate concentrations below the current drinking water standard. And it goes on. Here's another one. This time we estimated 3.26% of all colorectal cancer cases were attributable to nitrates, resulting in 100 cases, 41 deaths, and $43.2 million US. As you start to think about taking these additional cases that could be nitrate attributed and putting costs associated with them, like Heather had spoken about at the start, we consider there is sufficient evidence to justify a review of drinking water standards. And more of the same. This was a study in 2019 that looked at nitrate in the US with 2,300 to 12,500 nitrate attributable cancer cases annually in the US, the majority of those being colorectal cancer cases. This equates up to between 1.5 and 6.5 billion in medical and indirect costs. And this was a group at Duke, along with the Environmental Working Group, it's an advocacy group, and suggested a health benchmark of 0.14 milligrams per liter to account for colorectal cancer. Now, that is not saying, my interpretation of this is that is not saying that's where a drinking water standard should be, but maybe that should be our public health goal, right? And that we should be lowering that public health goal and trying to bring a standard down lower, closer in line to that, accounting for economics and technology, because as a point I'll make later in my talk, is nitrate removal is expensive, and that's the burden that prevents us from doing more. A lot of organizations that won register here in Iowa picked up on that study in 2019. They actually, to the EWG and their co-authors' credits, dialed this down at the state level. So you could attribute this to 300 cases of cancer each year in Iowa coming from the nitrate that we have in our drinking water. One of the things to be aware of is we have lots of folks in Iowa that drink drinking water with nitrate above 5. This is just an analysis we did from 2000 to 2018. Anywhere from about 750,000 to 1 million Iowans have above 5 milligrams per liter in their drinking water if they're in a regulated water system at least one point during the year. If you live in a big city that's on a surface water source like Des Moines and there's not treatment that's going on, you're basically drinking above 5 all through like May to August effectively. This is some of the data we've done. A paper I published with Chris, we were actually advocating for the use of these real-time sensors in source waters, because you actually can get a really good measure. The sensor data in the Raccoon River, which is one of the sources of Des Moines Waterworks, is shown here in the white circles. The finished water that the Des Moines Waterworks served to residents of Des Moines is shown in red. And you basically see good agreement everywhere, except for, say, this big stretch in 2015, where the Raccoon River was well above 10, and they had to use their treatment system to knock it down. And so it does give you the sense of the extended durations over which people could be drinking water. This is 10 here, right? If I draw a line at 5, which is where some folks have advocated a new standard, you see that there's not many instances anymore where the Raccoon River is below 5 as a source. And then there's towns like in Griswold. I always say in these talks that Des Moines is our best case scenario in Iowa. This is a small town of about 1,200 people. Here's 5 milligrams per liter here. Here's 10 milligrams per liter. This is our Trust Your Tap website for CHEEC. If you're here in Iowa, you can go to trustyourtap.org or Iowa Trust Your Tap, and you can look at regulatory data that's been submitted about water quality. But if you look at nitrate in Griswold, it's been between 6 and 10 since 2001. And so we definitely, and this is a smaller community that doesn't have the resources or the tax base of Des Moines to treat it to a level. I think you all should be paying attention to an ongoing study in Nebraska. Maybe some of you are aware of it, where there have been increased incidence of some forms of pediatric cancer. And there's been work done between University of Nebraska-Lincoln and some of the medical centers in Omaha looking at potential links to the environment and drinking water quality. There was a great series that's really accessible to broad audiences written by Brett Walton and Circle the Blue about this issue that essentially has been showing associations between both elevated nitrate and elevated atrazine, a corn herbicide, in the communities where they're seeing these increased incidents of childhood cancer. Nitrate is our neighbor to the west that struggles with nitrate in groundwater about as mightily as we do here in Iowa. And so we should be looking at what's going on in Nebraska and thinking that could be us here in Iowa, and we need to be doing that. All of this has sort of come to a head. For those of you outside of Iowa, you may not know that we are every year, the Iowa Cancer Registry puts out a report looking at cancer incidents in Iowa. In the most recent report, Iowa holds the dubious distinction. We're number 2 in the United States in terms of cancer incidents. We're only behind Kentucky, and that's often attributed widely to the amount of smoking in Kentucky versus here. But also, Iowa is the only state in the U.S. with a significant increase in cancer incidents from 2015 to 2019. So not only are we number 2 in the U.S., as a distinction that we probably don't want to have, we're the only state that's increasing year on year in cancer incidents. And so there's been a lot of attention focused on the environment here in Iowa, things like nitrate. And we're working with researchers here at the University of Iowa to look at potential associations, because people are beginning to wonder why we have these challenges in Iowa. And I want to be clear, there's lots of possibilities, right? We also have high radon levels in Iowa that we need to account for. We have high agrochemical use beyond nitrate. We have pesticides, but it doesn't mean that we shouldn't be doing the work to try to understand potentially co-exposures, both like they're seeing potentially in Nebraska, and other factors that might be leading to risks here that are unique to Iowa. So by this point of the talk, you're probably sitting there scratching your head and saying, well, Dave, with all of this, why aren't we doing anything? And so I thought I would try to explain to you why, in spite of what I've shown you, there hasn't been yet much of a push outside of a few advocacy groups to try to change the drinking water standard on nitrate. And one is that, as with all research, there's always new research, and not all research agrees with one another. And so this is a recent review article that did what's known as a meta-analysis, where they looked at previously published studies and did their own analysis on the data. And they were looking at nitrate and nitrite in drinking water and cancer risk. And it was sort of a mixed bag. Here's the details of what they looked at. They identified a positive association of nitrate exposure with gastric cancer. Okay, so there's a potential cancer endpoint. But unlike these other studies I just showed you on colorectal cancer, we found no association of nitrate exposure with colorectal cancer or cancers at any other site. And so here's one of these studies that would say there's these ones that have been pointing towards colorectal cancer. Here's one that suggests, well, we didn't see that. And so this is why most will say that we're at a point where more study is needed. We need to account for the fact that these studies get conducted in different areas. There could be different distributions of populations that are susceptible, different co-exposures that we're not appropriately accounting for. So it's not as clean cut as just seeing these studies that talk about colorectal cancer and assuming it's that way everywhere. And this is part of the reason I would say that everyone is proceeding with some degree of prudence and before a change is made or even considered. Similar here, nitrate contamination, drinking water, and adverse reproductive and birth outcomes, another meta-analysis. Similar thing, the evidence for an association between nitrate and drinking water and risks of smaller gestational age infants, birth defects, congenital heart defects was inconsistent, basically calling for more regular review and new evidence to try to work towards what the real causes are. To know that every 6 years since the 1996 Safe Drinking Water Act amendments, the EPA conducts what's known as their 6-year review of drinking water standards. Every 6 years, they reevaluate new evidence, like these studies I've been showing you, to say, do we need to potentially revise our standards, which is what would be necessary for nitrate. In the second 6-year review, which took place in 2010 when it was finally finalized, they noted that EPA is considering nitrate and nitrite as potential candidates for new health effects assessments because they acknowledged that there was new information, particularly related to its carcinogenicity. So I showed you back in 1990 where the EPA was trying to account for this, but they didn't have enough studies. Here they're saying, well, there's more studies, and in 2010, they knew they probably needed to do more and have this new health assessment get conducted. That's now going on 13, 14 years ago. Led to the third 6-year review. Now we're up to 2016. And I'm doing this in part so you see the pace at which the regulatory process moves around drinking water. And here it says, during the second 6-year review, EPA identified new health effects. Therefore, EPA nominated nitrate for a new health effects assessment, and that's done through EPA's program known as IRIS, the Integrated Risk Information System. So basically saying here that we've nominated nitrate to have a new health assessment, and now here we are 6 years later from 2010, and that step is going forward as part of this review. You look at the timeline on the Integrated Risk Information System. In 2017, EPA released their new plan here. And what that plan acknowledged, if you look at the document, is that they needed to account for risks from drinking water separate from risks that come from diet. That's this first bullet point. These other ones relate to specific susceptible populations that might need special consideration, because when you set a standard, you have to account for the most vulnerable populations that are at risk. And some of these studies were looking at increased incidence in, say, postmenopausal women as a subset that might drive a new standard. If you were, I'm getting ahead of myself. If you were looking very keenly at this slide, you'll notice that in April 2019, in the Trump administration, the EPA suspended that health assessment and felt that it wasn't in line with the agency priority. And unfortunately, it wasn't until October of 2023 that this preliminary assessment began. And so again, this idea of why aren't we doing anything, part of it is new science. Part of it is our regulatory process is painfully slow in responding to that science. In 2010, EPA acknowledged they needed a new assessment. Here we are in October of 2023, just getting started on that same assessment. I know that's got to be frustrating. It is to me, but this is the way revisions get done and new regulations get set. And so to me, in my opinion, this is just my opinion, waiting around for a revision of the nitrate MCL, it's just really not going to happen until there's broader regulatory changes to how we regulate what's in drinking water. We need to be much more timely and responsive to new information. Because I would say that nitrate, there's new information. I worked in DC for a year in Congress as a fellow on my sabbatical, and I talked to the committee I worked with and said, why aren't you pushing nitrate? And they said, well, what good would it do until we get complete regulatory reform? Because CIDWA is broken. And so I push most people towards this great article by Annie Snyder in Politico about what broke the Safe Drinking Water Act. If you want to understand why our regulatory process is so sort of ill-equipped to handle with new contaminants or new information. And not to give away the punchline too much, but if you look at how we amended the Safe Drinking Water Act back in 1996, we only set a new standard or revise a standard at this it has to have health effects, which we know nitrate has. It has to be in water at unsafe levels, which we know nitrate is. But there has to be meaningful opportunity for health risk reduction. And in policy speak, this meaningful opportunity has become a cost-benefit analysis. And nitrate costs a lot to remove. And so I'm dubious that we will see much change on a standard given the cost that would be necessary to get it out of everybody's supply. Things we can do, I'm probably demoralized you a little bit. We can talk differently about nitrate. I love this fact sheet from the state of Minnesota, or excuse me, the state of Wisconsin. Let's give credit where it's due. Everywhere in Iowa, all we talk about is blue baby syndrome. And I'll talk to people that have above 10 milligrams per liter in their water, and they'll say, oh, we're not expecting a child. We don't have anybody pregnant in the household. We're not worried about nitrate, even though it's 10, 15, 20 milligrams per liter sometimes. Here, they're talking about nitrate may cause thyroid disease, may increase the risk of colon cancer, may cause birth defects. We can change the way we talk about nitrate. It doesn't just have to be blue baby and that's it. We should be urging that precaution. And I applaud the state of Wisconsin for doing this. Any of you from Wisconsin on the call, write your Department of Public Health and thank them for talking about this the right way. And that's a good segue. I want to make sure we leave ample time for questions. And so I'll buzz through what I've got here. But I think you all know that nitrate is not an Iowa problem. This is like a classic graphic from the USGS that shows all the groundwater aquifer vulnerabilities to nitrate. And we've known this for some time. I couldn't find the age on this, but it's old. It's been with me since I was started being a professor. So this we've known. And there's been some great studies that have looked at how these trends are changing. This is a paper recently looking at trends in drinking water nitrate violations. You're looking at the mean annual number of drinking water systems in violation between 1994 and 2016. You see, we struggle in California, we struggle in Texas, we struggle in the Central Plains and here in the Midwest. Similar thing when you think about it in terms of the population that's being served. So much of that in California is that Central Valley with the agriculture. The takeaways from that paper talks about some of the shifts. In the interest of time, I'll draw you down to here. Nebraska and Delaware had the greatest proportion of systems in violation. Ohio and California had the greatest average number of people. And it's really our groundwater systems that are, have the most violations and duration where we're seeing this persistent nitrate problem. Follow-up studies by that group have basically pointed out using models, what puts you at risk. Percent cropland, ag drainage, irrigation to precipitation ratio, surplus nitrogen that's put on the land, surplus precipitation. So if you're looking for hot spots for where we have to worry about nitrate violations for public water systems, the Central California Valley, parts of Washington, Idaho, Great Plains, the Piedmont of Pennsylvania, coastal plains of Delaware, and regions of Wisconsin, Iowa, and Minnesota. I've mentioned this already a couple times. There's a great report that talks about the cost of nitrate removal. This is a study that looked at the Des Moines Water Works, a water treatment plant in Decatur in Vermilion County, Illinois. The headline here in blue, utilities spent 4 to 9% of their overall operating budget on nitrate treatment. And this is really putting an undue burden on smaller facilities that have nitrate in their drinking water sources. In the interest of time, I won't spend much here, but Des Moines Water Works is spending about $500,000 per year during their 6 years that they made data available in this study. Their largest expense was $1.4 million. That's getting passed on to consumers. That's pollution that's coming from the northwest portion of the state, coming down to one of our more diverse urban centers that serves 600,000 people here in Iowa, and they're getting stuck holding the bag of that $1.4 million in extra cost. And we shouldn't lose sight of the fact that there is a justice component to this, and this is particularly evident in California. This is a great study that was done by Laurel Shader, who's at the Silent Spring Institute, looking at that 5 milligram per liter threshold. We got about 5.6 million Americans that fit that criteria. But we actually see, particularly based on what's out in California, that the percent of Hispanic residents served by those systems was significantly associated with nitrate. So these burdens are not evenly distributed, and there are vulnerable groups that have been unduly burdened, smaller systems that are a high percentage of Hispanic residents. So in the interest of time, I'll probably stop after these 2 slides, but I'll just say, you should also be paying attention to that nitrogen and phosphorus can lead to harmful algal blooms and the cyanotoxins that come along with them. These got a lot of attention when they shut down the water supply in Toledo of Ohio back in 2014. We struggle with them here in the Des Moines area. Des Moines River, this headline from Circle of Blue, essentially unusable for 100 days due to algal toxins. You see the challenges that it can pose. And so to make sure we have time, I just had a couple more points, but I'll make them as we have the Q&A. The last bit was just a plug to make sure we don't forget private well water users, private wells, because they don't have the support decentralized systems have. So with that, I'll stop and make sure we have 10 minutes, and I can hang on a little extra as needed to make sure we have a good, robust discussion. Thank you for your attention. I hope that was informative to folks.
Well, thank you. I think I speak for everyone on the call for just saying a big thank you for taking this very complicated minefield of an issue and distilling it in a really accessible way. I know there's already a couple people in the chat who are excited to review the recording just to dive into some of those sources that you shared. So very much appreciated. And thank you again to everyone who is still with us on the call. Make sure if you have questions, the best place to drop those is the Q&A. That's just a little bit easier for us to sort through. So first, we did get a really nicely worded question in the Q&A, and I'm just going to go ahead and read it off so everyone can appreciate it. So as CAFO-related water quality issues have hit the press, a segment of farmers and stakeholders have cited synthetic fertilizers as a primary source of groundwater nitrate contamination. We know that manure concentrations can lead to contamination. We know that synthetic over-application can be a major issue as well. How do we usher meaningful and just change for both potential contaminants? How do we head off the political strategy of one practice hiding behind the other?
Boy, and so I do think, so I've said it a couple of times. I said regulations work, right? I really, and we here in Iowa, I'll speak to Iowa, we know there's over-application. There's some statistics that Chris Jones has shared in terms of the percentage that folks are over-applying. So there's things we can do in terms of you could regulate those inputs. You could limit what could get applied. You could change, make people adhere to guidance from places like Iowa State in terms of what should be land applied. You could enforce manure management plans, which is how we sort of allocate where manure goes. You could make sure you account for both manure and synthetic in terms of what totally is being applied. So there's things that just need to be done, but there are mechanisms to try to regulate those inputs, and they would probably work, right? and frankly, one of the things we talk about a lot up here is we're spending a lot of money on edge of field practices that, if you're not changing the dynamics of if you're not changing sort of the mass balance in the system, if you're over applying, you're going to overwhelm those systems, and we're not really going to make meaningful change. So I count me in that we need to make sure we are limiting what inputs go on the land. We need to be more careful there, and that's probably the first step to making sure we can make meaningful change in our surface water resources. I don't know if that's directly answering sort of the, the political realities of that are obviously hard, right? And so I, I don't know that I have the right answer of how you actually get something like that implemented, other than thinking locally, very locally, and getting your communities care, talking to at the city level, the county level, and just sort of demand change from that small, real focused point, at least here in Iowa, because we know that there's probably not going to be much regulation coming at the state level or federally.
Yeah, definitely. There is a second part to this question, which is another doozy, but definitely worth talking about. And you might have already kind of hinted at an answer, but it says, how do we make sure that we're working to change the practices within agriculture that put water quality under greatest risk without harming that important economic and cultural practice of farming?
Yeah, that's an excellent question. I guess what you really try to do is, we talk a lot, and I keep bringing Chris because he and I communicate a lot, and I want to give him credit. He has put a lot of thought into this and thinks about some ideas. Think about, there's a bill right now that was just introduced in the Iowa legislature that's about protecting riparian zones. It's about trying to take some percentage, some stretch of the land right up against the creeks out of production. And I guess the thing we always wrestle with is, why do we feel like we need to plant all the way up to the stream edge here in Iowa? Like, is that really, these important economic and cultural practice of farming? Can't we expect that we can still do some of that farming, but preserve some of that land that we know would make a significant difference of keeping sediment from out of our rivers, keeping the nutrient export down? To me, that seems like you can do this. We've just let it kind of go as anywhere at once, as far as it wants. And so maybe we start by just trying to do the obvious things, like why shouldn't we be protecting the stream edge? Like,
Yeah.
how can we not agree that that's a worthwhile thing to do, but yet we don't even do that here? So that's how I would answer that, is that, yeah, it would be taking some land out of production. It would come with some small costs, but if you think more broadly about all the externalities, all those embedded costs that then get passed on to other people, I think it would sort of work out in the favor of the people who are getting punished by the pollution.
Yeah. Many of which are producers themselves too. It truly is in everyone's best interest. Okay, another great question in the Q&A: for home well users, do home water filters like Brita help?
Okay, on Brita itself, unless it's so Brita is typically an activated carbon filter. Carbon will not remove nitrate. So the filter that's in your fridge, or if it's just straight carbon, it will not remove nitrate. For nitrate, you need to be using either what's known as an ion exchange device. And so that's one that has specific, what are known as resins, that are there to bind nitrate. Those have to be regenerated every so often. They have finite capacity. The other thing you could use is a reverse osmosis system. Normally, what I advocate for, if people have the financial means, because they're more expensive, is an under-counter reverse osmosis system at your primary point of consumption, and then use that water in cooking and drinking. And then the obligatory boiling does not remove nitrate. It actually makes the problem worse, because it evaporates off some water and concentrates the nitrate down. So you want ion exchange or reverse osmosis. And they're pricey, but if you have the means, it's probably worth it. And then we should be thinking about, how do we get those that don't have the means, that need it, access?
Correct. Okay, so might pesticides and nitrates sort of act together synergistically to create health effects in combo?
I think that's a concern that people want to look at. I'd say that's part of a broader dialogue about what we refer to as mixture toxicity, or co-exposures, that we know we're not just ingesting nitrate. You're ingesting potentially any number of things, and often at low levels, like levels below what things might be regulated at. And there's need to do more study to try to understand how we detangle what those mixture exposures or those co-exposures. So I would just say I'm not aware. There are some instances, I think, of ones where you can see these synergistic effects that are in the literature, but I think we need to do more of those types of studies to understand how common that might be. And that might explain some of why one study will show colorectal cancer incidence associated in one area, not another. Is there could be something else there that's acting as a trigger or co-exposure.
Next up, we have, what is the cost benefit analysis of mitigating the health effects of nitrate and other pollution? Like, where is the healthcare industry on this issue?
Well, so I mentioned that when we regulate, we do something effectively akin to a cost benefit analysis, and then there is an acceptable amount of risk that we're willing to take. We need to be, what's needed is more data to support these associations with cancer, and then more weight placed on those economic costs, the loss of life, the increased healthcare costs, the other things that we enumerate. Like when I show you that $1 to $6 billion tally, it accounts for all that burden. Because to be frank, I mean, the cost of removing nitrate at scale is incredibly expensive. I showed you what the Des Moines Water Works goes through. $1.5 million, I think, was the number at their peak time when they had the most nitrate in their source water. So you have to think about how you recuperate those costs. And so and from a regulatory standpoint, before things would actually happen. And I think we're going to need more evidence that shows these links so that we can be more convinced that we need to account for those health burdens in that sort of both balancing up the ledgers and seeing what comes out on top.
Yeah, definitely. Okay, moving along. This question refers to the PWTS, which is the private well testing system.
Private well tracking system here in Iowa. Yep.
And it asks, basically, is there a good way to extract more information from that database than is currently available to the public user?
There is. I mean, that's why we've tried to make it more accessible, and we're working on it. And Steve, I'll follow up with you since I know you, and we will work on that. We are working to get downloadable county data on our well forecasting system at CHEEC, and that's probably the best we can do without giving away people's personal information like their address, which we don't want to do. But in certain instances, for research and other things, we're happy to help make it more accessible to people.
This question asks, how much do synthetic fertilizers contribute? I think they're asking about what percentage of nitrate pollutions can be attributed to synthetic fertilizers.
Yeah, I'm going to have a hard time answering that, just to be, because it's going to vary depending on, how much of it's being applied to manure and other things in the particular location. So it can contribute if you over apply, obviously, but I think generally folks tend to be a little bit, where our challenges come from is the use of synthetic with manure still, right? And knowing that we have hogs being produced in close proximity to corn, so you can take that waste and apply it to that land, and that's when it all starts to add up. So yeah. I'm gonna not really be able to give you a strong quantitative number for just a synthetic piece.
Also, on a more local scale, depending on where people are tuning in from, you might not have manure and agricultural fertilizers as the primary source of nitrate in your locality. It could be from septic systems or more like commercial fertilizer application or wastewater. So there are lots of sources, but definitely when we're talking about the largest, biggest picture, ag fertilizers and manure are definitely the top contributors.
Important point. Yeah, I'm very much biased by my Iowa roots.
This listener is from Lynn County, and they use a private well, and they're wondering what steps they should take to check for nitrates. Where do you get your well tested, and what do you do if it has high levels of nitrate?
Yeah, so for everybody on the call, not just in Iowa, if you have concerns, the first people I'd reach out to are your county public health offices. If you're definitely on a private well, they usually have responsibility. So for you in Lynn County, reach out to Lynn County Public Health and ask about getting your well water tested through Iowa's Grants to Counties program, which is a program where we make testing at no cost accessible to well users. But we do that only in Iowa. There's other states have other programs. And then if you find values are elevated, then you can think about installing a home unit, or if I don't think bottled water is a solution. Frankly, it's too expensive, and it might have as much nitrate as your water because it's not as stringently regulated. So treatment systems are probably the best way to go, rather than trying to use a purchase source.
And when you use the Grants to Counties program, they're going to use a lab to test your water and tell you all kinds of stuff about water quality. If you're interested in more of a dipping your toe into testing your water and maybe with more regularity, Nitrate Watch is also there for you.
There you go.
Okay, next up, if we need to reduce our nitrate inputs, would it not be possible to monitor tiles in the field and check those levels with lab results?
You absolutely can. And you got to find people that are willing to let you access them and do the measurement, right? And then you got to figure out if people are going to be responsive to those results and change their behavior. And so research projects like that have been done in Iowa. Tile lines can push out really high concentrations of nitrate. It just requires partnerships and meaningful, efforts to really want to change based on what those results show. And I think can that be done at the scale we need here in Iowa to drive change? I don't know.
And I will acknowledge that we are past 1 o'clock, so thanks for hanging in there. We do have a couple more questions if you're okay to hang on, Dr. Cwiertny.
I've got about 5 more minutes, and then I probably got to go.
Okay, definitely. We'll go fast.
I'm trying.
This question resonates with us definitely in the world of communicating about nitrate pollution, but have we done enough to publicize the contamination occurring in small town water supplies so producers realize the effect that they are having on their neighbors?
I personally don't think so. It's not an indictment against anybody in the media in terms of telling those stories. Incidentally, I'm part of a National Science Foundation funded project where we're trying to use stories along with data to get people to grow awareness and understanding. So we're working to tell those stories. We need people that want to talk to us. I get asked a lot about, do you know of a private well user we could talk to that has high nitrate and has had their life sort of impacted? And yes and no, like we know of areas, but we rarely, or if people want to talk on those issues and help elevate it, we will happily work to connect you and amplify your voice. And but I think we need more people that are willing to share those stories. And I know it's not always easy, right? So that's my answer on it. And we do a little bit of work in this area. I think we're part of how we change things is we use people's lived experience to start shifting the narrative about what the reality is of nitrate contamination, the burden that it brings, and use that to sort of offset sort of the press and PR we get from, the usual interests here in Iowa to talk about how we're, leading the world in productivity for agriculture.
Yeah. And I think to Steve's point, the question asker, it makes such a difference to hear from your neighbor, someone that you know about the impact locally, because I think a lot of us would like to imagine this is a really far downstream problem, but the reality is that it is very much not. The next question we have kind of already answered. Do areas that have a lot of fertilized lawns cause elevated nitrate levels?
I mean, it depends on the proportion of fertilized lawns versus other sources, right? And so there are likely areas where that's an important source, just like there are areas where septic system leakage is or discharge is an important source. And so in Iowa, it turns out that there's just the amount of nutrients that could be coming off our watered lawns if you're applying pesticides and nutrients. It's just not really comparable to the scale of what we see getting on the land from our land use.
As you all are applying fertilizer to your lawns, you can definitely be mindful of the impact that we have. But yeah, as Dr. Cwiertny says, it's a drop in the proverbial bucket. Are we aware of any other states that have a program kind of like grants to counties in Iowa that has well testing for individuals?
I mean, everybody has programs in place to test for wells. I just don't know which ones do it at no cost. You're always welcome to contact your local state labs or other private labs, and they'll happily take your money for testing. Wisconsin's got some things going on now, Nebraska, Minnesota. I'm more familiar with the Midwest states where I think there's much more of an increased attention on private wells currently. In Iowa, we have a great program. We're trying to actually expand it with the things we do at CHEEC and offer some low-cost testing to look beyond the typical things that get measured. So I would say if you have questions about other states, start with those public health offices in your home state. They'll be able to push you where you need to go.
Yeah. I attempted to do a little bit of a review of what different states offer, and it really varies on what they test and whether it's free. But definitely just start searching on your public health department. Does CHEEC typically issue press releases?
We do on occasion when we have like new websites or new studies that we put out, but not. We also have been working on some fact sheets. Honestly, your best if you're interested in what we're up to, just shoot me an email or give us a call. We'll talk to we get a lot of inquiries. We're happy to talk with you all. And then we'll do our best to push out our studies that we do. It's just an issue if anybody picks them up beyond what we put out at the University of Iowa.
Awesome. I know we have a couple questions still lingering, but I do want to be respectful of everyone's time. So Is there an email address that you gave that people can reach out to if they still have questions?
Give me 1 second. I'll put my info up. I didn't get to my
Awesome.
last slide, and I should have. So 1 moment. We will.
Well, and while you're doing that, I'll just remind everyone we are sharing a recording, so definitely feel free to revisit. And another huge thank you to all of the participants for the great questions and great conversation. And of course, Dr. Cwiertny.
You're welcome. Here's my info. Feel free to give me a ring or drop me an email. You can follow us on some of these social media sites and things if you're interested.
Awesome.
Cool.
Well, thank you again, and we will see you soon next time.
Thank you.
Bye.